Good morning. Today we will discuss about the parotid gland relations of the parotid gland. First we will study about the apex. The structures which are related at the apex of the parotid gland are, we can see the parotid gland like this. The relations of the structures which are emerging at the parotid gland are two veins, the anterior division of retromandibular vein, posterior division of retromandibular vein, and there is a nerve, the cervical branch of facial nerve. These are the two structures. One nerve, that is cervical branch of facial nerve, and these are the two divisions of anterior and posterior divisions of retromandibular vein. How the cervical branch of facial nerve emerges through the apex, that is, the facial nerve enters into the gland and divides into two divisions. Again it branches into 5. Out of 5 terminal branches which are forming within the parotid gland, the last branch, one of the terminal branch, cervical branch of facial nerve, emerges through the apex of the gland. So these are the relations on the apex of the gland. The apex is directed downward. It overlaps the muscle. This is the position of the mandible. If this is the position of the mandible, here is the mastoid process. Then the gland, at the lower part, the apex overlaps the muscle, posterior belly of digastric, and upper part of carotid triangle. That is the digastric triangle, posterior belly of digastric and anterior belly of digastric forms a boundary of digastric triangle. So below the digastric triangle it is continuous with the carotid triangle. So that the lower part or the apex of the parotid gland overlaps the posterior belly of digastric and the upper part of carotid triangle, forming as a continuation of digastric triangle, and two structures emerges from the apex. One is a arch vein, the other one is a nerve. Nerve is cervical branch of facial nerve, vein is anterior and posterior divisions of retromandibular vein. The superficial temporal vein, which drains from the temple region, and the maxillary vein, which drains from the infratemporal fossa, both are forming together to form the retromandibular vein. Retromandibular vein. This retromandibular vein again divides into 2, and these divisions are known as anterior and posterior divisions. These divisions emerges through the apex of the parotid gland. So these are the relations of the structures which can be seen at the apex of the parotid gland. They are anterior and posterior divisions of retromandibular vein, cervical branch of facial nerve. So that is all about the apex. Next is about the base or superior surface. The base of the superior surface, we can draw it like this. The superior surface is concave. It comes in relation with the external acoustic meatus or external auditory meatus, which is the opening of the ear. It comes in relation with the external acoustic meatus, and here is the position of the mandible. The head of the mandible can be seen here. So that the base or the superior surface related to the external acoustic meatus or the external auditory meatus and the posterior part of temporomandibular joint. The temporal bone with the head of the mandible joining together in relation with the external acoustic meatus or inferior to external acoustic meatus, it is known as temporomandibular joint. So, the posterior part of temporomandibular joint, external acoustic meatus are the relations which can be seen at the base or the superior surface. There are some structures emerges from the base or the superior surface. They are, one is the superficial temporal artery, the other one is superficial temporal vein, and the last one is the auriculotemporal nerve. Auriculotemporal nerve. The three structures which are emerging from the parotid gland at the base are the superficial temporal artery and vein, superficial temporal artery and vein, then auriculotemporal nerve. It is a nerve to supply the scalp on the temple aspect. Auriculotemporal nerve. These are the relations which can be seen at the superior surface. So, how the artery and vein forming in it? That is superficial temporal vein joins with the maxillary vein to form the retromandibular vein. That is the fate of the superficial temporal vein in the parotid gland. Like that, the external carotid artery which is coming towards the upward direction within the gland divides into two, the maxillary and the superficial temporal artery. So, the branch of external carotid artery, the superficial temporal artery, and the accompanying vein along with the auriculotemporal nerve. These are the three relations. These are the three relations can be seen at the base or the superior surface. Base or the superior surface. Next is about the relation on the superficial surface.